This is Dr. Shakil Ahmed. Today I will present the third video about breast ultrasound. This video will include breast composition and the age-related changes of the breast tissue. Breast is basically composed of fibroglandular and ductal tissue surrounded by and intermixed with fat. It is completely surrounded by superficial and deep fascia and covered by the skin. Breast tissue extends from the second to seventh rib but can extend as far superiorly as the clavicle bone. Sternum and anterior axillary lines mark medial and lateral boundaries respectively, but breast tissue can extend into the axilla. The glandular parenchyma is composed of 15 to 20 lobes, each with its own duct, terminates in nipple. In this image, we can appreciate the lobes which are lying. These are connected with its ducts and finally it terminates to the nipple. The yellow part of this image shows the fat. This is the pectoralis major muscle and these are the ribs. This is the deep fascia. Montgomery glands or small isle glands located around the areola, and it releases a lubricant that protects nipple during nursing. Each excretory duct branches into multiple segmental duct, terminating as extralobular terminal ducts or terminal duct lobar unit. These are the areas from where most of the breast cancer arises. This duct continues as the enterolobular terminal duct and branches into 10 to 100 blind ending ductules called acini. The enterolobular terminal ducts and acini are surrounded and contained by loose fibrous conductive stromal tissue. This unit is called lobule. There are approximately 20 to 40 lobules per lobe. The connective tissue is present within and surrounding the lobular units. Blood supply. Arterial blood supply of the breast is from lateral mammary branch of the lateral thoracic artery. The second branch is anterior cutaneous or perforating branches and branches that are derived from the second to sixth intercostal arteries. Venous flow. Describe an anastomotic circle around the base of the nipple, and this is called circulus venosus. From the circulus, small veins take the blood to the circumference of the gland before terminating into the axillary and internal mammary veins. Breast lymphatics. Breast lymphatics is much more important as the lymphatic drainage is the root of spread of malignant diseases. There is superficial and deep plexus of lymphatic vessels. The superficial plexus lies beneath the skin. It receives efferent vessels from gland, its efferent lymph to lymph nodes and pectoral and infraclavicle chains. Deep plexus that lies in deep fascia on which mammary gland rests. This plexus directly receives most of the lymphatic drainage of the breast. When suspicious mass is found, sonographer has to look for lymph nodes in axilla and along the most proximal lymphatic drainage pathway. These images show the lymphatic drainage of the breast tissue. The lymphatic system drains lymph from breast medially, superiorly, and laterally. The highest risk for metastasis is in the first node, along the drainage basin of the lymphatic system from the location of suspicious lesion. So, the sonographer should investigate axilla in the lymphatic chain closest to the suspicious lesion for evidence of metastasis. Age-related changes. In pre-pubertal child, breast contains few small ducts scattered throughout the fibrous stroma without formation of lobules. With onset of estrogen secretion by ovaries, glandular tissue enlarges quickly, and this is called telarchy. This development occurs before menarche. Asymmetric development may simulate hot subareolar nodule. In here, we must be careful that to do not label it as tumor. Excision will remove all of the glandular tissue and prevent the development of the breast. In young women, glandular tissue is relatively thick and subcutaneous, and retromammary fat areas are small. During pregnancy and lactation, the size increases and the number of the terminal ducts are also increased. Breast fatty tissue is reduced. Occasionally, asymmetric secretory changes may occur, resulting in a palpable abnormality. Involutional changes occur after full-term pregnancies with progressive thinning of the mammary zone. The parenchymal and stromal atrophy is most pronounced in the area between the Cooper ligaments. In extreme involution, the parenchymal elements are almost absent and only strands of connective tissue are seen, appearing as echogenic bands between the isoechoic fat. Thanks for watching. This video is presented by Shakil Health Society. Thank you.